Hello, good afternoon, everyone. Is it evening, night, or morning, whichever time zone that you're in? I'm here at the Canouan Health Centre, and I'm going to speak briefly with some of the staff here. I have Nurse Spear here with me. Miss Spear, how are you doing?
I am good. Good afternoon, and you?
I'm great. I'm great. The month of October is Breast Cancer Awareness Month. What is breast cancer?
Well, breast cancer is really cancer that is localized in the breast.
It's localized in the breast.
It's abnormal growth of abnormal cells in your breast.
Okay. Yeah. And are there different types of breast cancer?
There are many types of breast cancer. There is male breast cancer, because male can't get it. There is inflammatory breast cancer, ductal breast cancer, just to name a few.
Okay. What are the symptoms?
Well, there is changes. You see different changes in the breast. But first of all, most of the time it starts with maybe a pain in the breast. You might feel a discomfort in the breast, and when you feel there might be a lump, right? And any lump that is felt in the breast should be checked out. There could also be changes in terms of the contour of the breast. You have what we call peeling and dimpling, or the orange peel look. If you look at an orange peel, you see the little spots, like dimples in the orange peel. It may look like that. There might be a discharge from the breast nipples, right? That is not normal. Usually, as long as you're not a breastfeeding mother where you're producing, you're lactating, you should not have a discharge from the breast. So as long as there's a discharge, it should be checked out as well.
Okay, so when is the best time to check for breast cancer?
I think a person should always be checking the breast. It should be a regular thing. There's what is called a self-breast examination, which we should do as often as we can. We can do it weekly, we can do it monthly, because it's something that we can do for ourselves. Your usual checkup with your GP, your general practitioner, should suffice, whether it's once or twice in the month or whatever. You check with your general practitioner, and you ask them to do an examination if you cannot do it for yourself, right? And this will aid in early detection.
Right. So how do you mention men can get breast cancer, women, but is there an age factor involved?
Not necessarily, but I think usually persons in the 20s to early 40s, 50s are more prone.
Okay. So how can I screen?
Screening test starts with you. As I was saying, you do your regular self-breast examinations, right? Because you will be the first person who will detect whether there's a discharge, whether you're having pain, whether there's a lump in the breast. So as long as you notice, or even if you look in the mirror and you see the signs.
Okay. So that is what screening is.
Right. Right. There are other screening also, where if you detect those symptoms and you go to your practitioner, there are tests that you can do. You can do the mammogram. You can do ultrasounds and so forth, that X-rays that will detect the cancer cells also.
Okay. How fast does these cancer cells for breast cancer?
For the breast cancer, they do develop rapidly. And if they're left untreated, they can spread to other parts of the body. Oh. Yes.
Okay.
Yes, they do develop very rapidly.
How do you treat?
Well, that will depend on the stage, because there are different stages of cancer.
Okay.
Yes, every cancer comes with different stages, so it will depend on the different stages of cancer.
So what are the different stages?
Usually stage 1, stage 2, up to stage 4. Stage 1 will be where you just have a localized the lump.
Okay.
It might be there. Stage 2 might be where you start having different symptoms. You may have the dimpling, maybe the discharge. Stage 3, it's where most of the breast might be affected. Stage 4, it is the whole breast is affected, and there's possible spread.
Oh,
Right?
wow.
And at stage 4, most of the time it's irreversible. There's nothing that really can be done after stage 4. Right.
Okay. What is radiation? I've heard persons speaking about radiation. What is that?
Radiation is where they use is like electrical waves,
Okay.
to destroy, so to speak, the cancer cells. It's a non-invasive way of treating or getting rid of cancer cells.
Okay, so how soon after a surgery can somebody begin doing the radiation?
I would say, I'm not sure on that question, but I would say radiation therapy would start as soon as you are recovered from, you're strong enough to do that.
Hello, I am here with Sister Foxy Compton.
Hi, Ansel.
Hi, how are you doing?
I'm good, I'm good.
Good. So we are here. We're talking Breast Cancer Awareness Month, October. And I've heard that you are organizing a walk.
Oh, yes.
When is the walk scheduled for?
It is scheduled for Monday, the 31st of October.
Monday, 31st of October.
Yep.
And who's involved?
Well, so far we are trying to get everybody involved.
Everybody involved.
And I do mean everybody. We have the entities in the north, those in the middle, those in the south. Yeah, we're trying to get everybody. The thing is, once we started making plans and trying to get people involved, then you realize that there are so many people who think that this is something that we really should do for the island, and people who are planning to have walk, and so they decide, okay, in that case, we'll just join with the clinic. Yeah.
Wonderful.
Yeah.
Wonderful.
I think so too.
And you said it's the 31st.
31st of October, Monday.
It's a Monday.
4 o'clock in the evening.
4 o'clock in the evening.
We're hoping to get through by at least 6:30, you know.
Okay, where will we be starting from?
At the bank and go over Babru side, come around, go over Balance side, and then come up Retreat.
So we're starting from the bank.
Yeah, it'll give us a longer distance.
Up the hill.
Up the hill.
Go over.
To
Babru's.
Babru's.
Down to
Come to
Friendship. Up Balance.
Up to Balance.
Come around.
Yep, down Bachelor's Hall.
Down. You're going down Bachelor's Hall?
No, just down that main road.
Okay, down to Pompey's.
Right.
And up the road.
And up
you're
the road.
finishing off where?
At the clinic.
Come back at the clinic.
Yep.
And when we get to the clinic, what happens?
Yeah, and that's when we have our grand rally. We are talking about presentation on prostate cancer. We're talking about presentation on breast cancer.
Okay.
We're talking about demonstration on how to do self-breast examination.
Great, because I spoke with Nurse Spear, and she was telling me about how you can do the checks and stuff like that.
Right.
So it'd be nice to have someone show me, because
Somebody
she told me
show
that
you how to
men
do
can get breast cancer.
Oh yes, they can, and that's the thing. Sometimes I think our men don't realize that they can get cancer, and so I mean, Simmons and Danny Grenadines, Canouan, until you're on the island of Canouan on 31st of October, you need to take part in this march and rally there. You need to.
Because
There's some information that is going to really help you. We're even seeking to get, keeping our fingers crossed, seeking to get somebody who would have been affected by cancer. I'm trying to get her to say yes to coming on board to do a 5 minutes presentation as to how it affected her, how it affected her family, how she feels now about it, because cancer is real. It is real, it is not going anywhere. However, together, if we do this together, we'll be able to strengthen one another, encourage one another, and yet live a brighter life.
Because I know of breast cancer, I've heard about prostate cancer, and also colon cancer.
Because the thing is that you know that breast cancer and prostate cancer is among the top 10 deadliest cancers.
Okay.
And if you can think it, you can get a cancer there. Skin cancer, bone cancer. We'll talk about the colon and the intestines and stomach, throat. As a matter of fact, I was thinking this morning that since I've been working here in Canouan, I've encountered 2 persons with cancer of the throat. Both of them died, a male and a female.
Oh, that's sad.
And this is right here on our little island, Canouan.
So
I've
we need to
encountered
educate
intestinal cancer, prostate cancer, stomach cancer since I've been working here on the island.
Oh.
So it is
How
real.
long have you been working here?
I've been working here since 2001.
Wow.
Plenty long time.
It's a very long time.
But I'm really excited about this march and rally.
Me
And
too.
prior to the march and rally, guess what?
I don't know.
Prostate tests
So you can test for
and
prostate?
breast tests, the 28th of October, right here at the clinic.
you
So
got- okay,
all
cool.
the men over 40,
So I'm gonna
come on
come
in,
by.
get their prostate test, and the females can come by and we can do. Bring your girlfriend, bring your sister, bring your big brother. Encourage one another because
So you're
you
here
know the whole thing.
28th.
The 28th, Friday the 28th.
Friday the 28th.
Friday the 28th, right
So
here at the
come in
clinic
here at the clinic. What time? From what time?
from 9 o'clock.
From 9 o'clock. Okay.
Yep.
So you can come.
But I know men usually are afraid of these
No,
things.
I did a check already.
Yeah, I know men are usually
No,
afraid of these things.
Because now you can actually test for prostate cancer using the blood.
Right. And
So
we have Dr.
close
Pope on board with us.
Okay.
You know, Dr. Pope is on board with us. Mandarin, Soho, Canouan Estate, the Marina.
That's great.
Everybody's on board with us.
I know you
So-
have Canouan Islanders on
And
board. who
Canouan
will
Island.
Let persons know exactly what's taking place. So
Yep.
the 28th is for the testing,
Don't wait until it's too late.
and the 31st
It's for the march
is the
and
march
rally.
and the rally. All right. So
We are also seeking to have a fundraiser by selling T-shirts for that march and rally.
it'll be great.
Guess what?
So let me know when you
We
get
are
that.
planning that
You have plenty of things
proceeds
planned, boy.
of-
There's a
from
load of
that
using often
fundraiser
plan.
would go towards assisting somebody who is living with cancer on the island.
Okay.
Yeah.
But are there persons here who have cancer?
Well, yes.
Yes. Okay. So
Yes, yes.
you can see what we can do.
Yep. Can see. So support us. Come out and march, and don't say that it's long. It's not long. We have DJ Malcolm gonna go around with us. You know,
Okay.
they getting the police involved. Everybody. It's one
Everybody is involved.
community. One community. Getting the schools involved. Getting the children involved. Getting the churches involved. Getting everybody involved so that we can make this count.
Okay.
Can make this count.
So I'm going to be there.
See, I'm wearing my
I'm just going to tell you, I don't
this
start
is
wearing
actually,
my
This
thing.
is actually my T-shirt from the last March and Rally that we have, Breast Cancer Awareness Month March and Rally we had in 2018.
Yeah, I wear my pink.
Yeah,
And
this-
I was told I look good in pink. so
Come
I
on,
make sure
only
I-
handsome guys can
Come
wear
on,
pink and pull it
come
off. Come on.
Thank you. Thank you.
Yes,
All right, so
yes.
thanks for having me.
You are so welcome. Thank you for coming by.
No problem.
Yeah.
Just let me know what's taking place.
Alrighty,
And of course, I'll try my
definitely, we'll
best
let you know.
to accommodate. So, it's October, Breast Cancer Awareness Month. The 28th, we'll be here doing screening for prostate and the breast cancer. On the 31st, that's a Monday,
4 p.m.
4 p.m., we walk in, starting from the admin building that is opposite the bank, for those of you who don't know. And we walking up the hill past the Adventist Church, up, we climb in, go over to Babru's, down to Friendship, up Balance Hill, then we go down to the Tambran, down to Pompey's area, turn and up the road, and we're reaching back right here
Right,
at the clinic.
Yep, you got it.
So I know people have to talk about snacks and things. The only snack I want is water, fruits, vegetables, because
We are organizing that.
that is why on right now.
We are organizing
fruits and
that.
vegetables and water. So have that for me, and I good.
Once our beautiful people who we are trying to seek to assist us with this thing, come through for us, then you'll get just that.
Right. So
It's cancer, we have to go healthy.
healthy. I'm telling you, that's what I'm doing right now.
We got to go healthy.
Doing right now. So thanks for having me.
Thank you very much, sir.